Coronavirus cases and hospitalizations in the U.S. continue to climb at an alarming rate. Nearly 51 million Americans have contracted the virus since the start of the pandemic. There have been more than 803,000 coronavirus-related deaths. Hospitals in some parts of the nation are being stretched to their limits. And now, the new wave of infections is prompting cancellations and disruptions right before the holidays. Meg Oliver has the latest from New York City.
Tonight, health officials are sounding the alarm. New COVID cases are up nearly 40% in 2 weeks, fueled by the Delta variant and Omicron spread.
It's so highly transmissible that it's just going to sweep across the country like a firestorm.
Dr. Anthony Fauci predicts Omicron could become the dominant variant in the U.S. soon.
We're looking over our shoulder at Omicron, which will assume a dominant role, I would imagine, within a period of a few weeks to as we go into January.
Now officials are bracing for an explosion of infections, although cases so far have been mostly mild.
I think it's going to be pretty rough now, heading into the holidays and then the early part of the new year.
The CDC expects new cases to surge 57% in the coming days, with as many as 1.3 million cases reported the week of Christmas.
Things could get really bad, particularly for the unvaccinated.
Today, CDC advisors voted unanimously to discourage anyone 18 or older from getting the J&J vaccine, citing evidence that it could trigger a rare blood disorder that has been linked to at least 9 deaths. And the list of companies telling employees to work from home is growing. Citibank announced today its employees in New York and New Jersey could begin working from home again.
With Omicron surging right now, is it too early to return back to the office in January?
At this point, I wouldn't push it. Let's see how this unfolds.
And with Christmas only days away, the demand for tests is skyrocketing. Alyssa Peralta is feeling fine, but wanted to make sure she was safe to travel back home to Chicago.
Are you worried about traveling this holiday?
I definitely am. I am really scared.
I talked to Alyssa after she got her test results and they came back negative. She now plans to get a booster and keep testing before she flies home next week, which is exactly what the experts recommend. Lana?
Might be a long line, but time well spent, Meg. Thank you. For more now, I want to bring in Dr. Shad Marvasti. He is the Director of Public Health Prevention and Health Promotion at the University of Arizona College of Medicine in Phoenix, as well as an Associate Professor of Family, Community, and Preventative Medicine. Dr. Marvasti, welcome. So according to the CDC, Omicron could replace Delta as the dominant variant here in the U.S. How would that change the country's response to the pandemic?
Well, I think that it doesn't change much in terms of the public health mitigation measures, and that's something that's really important. No matter what variant is out there, people need to recognize that masks work to stop the spread, and in particular with Delta and now with Omicron being even more transmissible than Delta, a higher quality mask is what's really important. So I would recommend KN95 or N95, especially if you're going to be in a public indoor setting for more than a few minutes, improved ventilation with portable HEPA filters, all the stuff that we're used to over the past year, which has been shown to work, is really what we need to do, as well as get as many people as possible vaccinated and everybody who's eligible to get a booster shot to get boosted.
Great advice. Did an interview recently with the mask nerd who really reinforced the idea that all masks are not created the same, and especially if you're traveling or have young children, those KN95, those N95s, much better at filtering those particles. Dr. Marvasti, Dr. Anthony Fauci says that the current booster shots are effective against the Omicron variant, which now accounts for 3% of cases in the U.S. What kind of questions are you getting from your patients regarding vaccines and booster shots now?
Well, yes, I'm getting the question about, is the vaccine going to protect me against Omicron? And, for the most part, we know that you're definitely more protected with the vaccine and with the booster as the data is beginning to be examined and some of it's coming in. We know that the risk for severe illness and hospitalization is still much less, even with Omicron, if you're vaccinated, and even more so if you're boosted. Although the risk of just getting an infection, a breakthrough infection, is higher now because of how transmissible Omicron is. I get the question of, well, is Omicron really just like a cold now because perhaps the severity is so much less? And that may be the case for a big chunk of folks. And a lot of it may have to do with the younger demographic, also people who have been vaccinated getting a breakthrough infection, which results in a more mild infection to begin with. But it's still really too early to tell. And because our healthcare system's already really at the edge in terms of at the capacity right now, any cases, because of the fast increase in explosion, remember Omicron spread right now in the UK, it's doubling every 2 to 3 days. Compare that to Delta, which was doubling every 2 weeks. It just may happen too quickly. Even if it's relatively more mild, it's going to make a big impact on our already depleted hospital capacity and healthcare workers.
Sure, and even if it's more mild, if there are people who are not fully vaccinated or not vaccinated at all, it's not that same mild disease, at least according to preliminary information that we've seen. That actually leads me, Dr. Marvasti, to ask, are we now at the place where fully vaccinated means boosted?
I think we're getting there. I think we will be there. Probably, I would say, by the end of January, if not sooner. Omicron will be the dominant variant in this country, I predict, by the end of January, possibly sooner. It remains to be seen if that would be a mixed blessing if it ends up being milder. But again, when we talk about it being milder, Lana, exactly as you said, it really depends on if you're vaccinated, boosted, or not. For the unvaccinated, the risks are still terribly high and much higher than before in terms of getting it. It's not about whether or not you will potentially get it. It's just about when you will get it. And the risk, of dying from COVID, as we already know with Delta, is 11 times higher nationally if you're unvaccinated. Here in Arizona, we found that number to be 15 times higher if you're unvaccinated. So my strong recommendation to everyone, in addition to wearing masks, getting tested when you're going to connect with loved ones to make sure you're not carrying the virus, is to really get vaccinated if you haven't. And natural immunity doesn't work. I just diagnosed 2 patients this last week who had COVID in 2020 with COVID because they decided not to get vaccinated despite recommendations. And, now they're in the hospital and thankfully they're receiving the, monoclonal antibody therapy and hopefully they'll respond to that. But that was preventable. That wasn't necessary. If they had gotten vaccinated, even after recovering, they would not have been this sick.
And I mean, it's staggering when you're talking about the risk of death from COVID. It's not 15% higher, 15 times higher. Dr. Marvasti, a CDC panel held a meeting Thursday to discuss possible limits on the use of the Johnson & Johnson vaccine due to these continued blood clot issues. How concerning is that for the tens of millions of Americans who have received the shot? Does it really mean that if you received it earlier and you've done fine, that you don't need to worry, or should you still be concerned about that?
I don't think you need to be concerned if you received it earlier. It's really at the point where you have received it. Usually we're seeing the sequelae within like weeks of receiving the dosage. Remember, it's just one shot. So, I definitely would probably go with the mix and match. If you're someone who received the Johnson & Johnson, go ahead and get your booster either with Moderna or Pfizer. Don't do a Johnson & Johnson. Again, because of that risk. It's still a pretty low risk. But I think they're erring on the side of safety, not so much because the risk has been so dramatic, but because we have such an abundance of Moderna and Pfizer vaccines, which don't have that kind of risk associated with them. And so since we don't have a vaccine shortage here in the United States, thankfully, we have more of a misinformation problem where people aren't availing themselves of the vaccines that they have available. That's why we might as well use the best vaccines with the best efficacy and safety profile, which at this point are the new technology mRNA, Moderna or Pfizer vaccines.
All right. Dr. Shad Marvasti, thank you for joining me and thank you for all that you do.
Thank you, Lana. I appreciate it.